Yes, and we did say that it occurs soon after birth. And we said postpartum blues is also known as baby blues. What are some of the causes of baby blues? The hormonal changes. So you're going from being pregnant to non-pregnant. It's as if the ship turned over from the bottom to the top. So it's a whole shift in hormones in your body. So you're going from being pregnant to non-pregnant. There are so many things, you know. You're happy that you have the baby, you know, but then you're so tired. You know, there are so many emotions going through you. Was I ready for this? You know, should I have waited a little longer? You know, there are so many things. So that change in the hormones, it makes you very emotional. That is the word. Coupled with a lack of sleep. You know, of course, you bring a baby home. How many of us really sleep? Since we have started having children, we just sleep for the few hours or minutes that we can get, don't it? We have not really slept how we would really want to sleep. You remember that sleepless, you remember those sleeping that you used to sleep until you said the sleep say wake up? How many of us, since we have started being mommies and daddies, really have gotten that sleep? I can tell you I have not. I only sleep when I can at this point. You know, and I'm a mommy of 16 years. I have a 16-year-old daughter and I have a 6-year-old son. And I can tell you, I have not slept since I had my first child at will. I have just been sleeping when I get a chance. You know, and so I know it is the same for some of you and probably worst. You know, for many reasons. Maybe you have a child who is in the nursery. Maybe you have a child who has a condition. You to come to antenatal clinic. We just don't want you to come because we need something to do. Antenatal care is important because we're preparing you also for after delivery, which is our postnatal phase. So you get to learn how to deal with the baby when the baby comes fussy, the things to look for when the baby becomes colicky, you know, how to put the baby to sleep, how to have the baby to latch on the breast, what to do if in the first few days the breast milk is not coming, the colostrum and the breast milk is not secreting, what to do, how to cope when situations get worse, how to cope when you're feeling the postpartum blues not resolving after a few weeks and it's going over into another condition which we'll talk about in a few, and then if you don't get help with that one, it goes over into another condition that is more severe that we will delve into in a few minutes also, right? So poor postnatal preparation will see some mothers going through these traumatic situations. Stress and anxiety. So you have to be getting up, bathing the baby, feeding the baby. You're not able to eat how you want to. You're not able to sleep how you want to. You're wondering if you're caring for the baby enough. Are you being a good mother? Was I ready for this? So, you know, and there's so many things. So yes, you have two types of stress. You have good stress and you have bad stress. So in this case, it's good stress. But with good stress, it still comes with a lot of pulling on your body energy, you know, and you're like, oh my God, am I really a mother? All right, I need to wake up the baby every 2 hours. I need to make sure this. And you know, you're so anxious and your adrenaline is all over the place. And then of course, a lot of mothers go into distress because of the body changes. You're normally used to your flat tummy, you know, and your breast all the way up here, you know. You would have had some chloasma changes in your face, you know. You'd have, some of you who would have had a cesarean section, you know, have a scar under your abdomen, you know, the pain that comes with it, the itching, the burning to the cesarean section site. For those of you who would have had a vaginal birth, who would have suffered a laceration or an episiotomy, you know, have sutures to deal with. You have to be doing your 6th bath, you have to be taking antibiotics, you have to be taking pain meds. It's so many things. Some persons even do suffer pelvic damage during delivery. So the body changes, just the fact. And then even in postnatal, some persons would have gone through postpartum shedding. So you'd have had your long hair. And then all of a sudden the hair just cut off. You have to now cut the hair very low, which you have never done before. So there are so many things that are taking place in your body and happening to you that is just, it's like it's a whole movie. You know, it's a whole movie playing out in front of you and you're unable to adjust, you know, in time. Because as we said, poor postnatal preparation in some persons, lack of home help, lack of sleep, changes in the hormones, the stress and the anxiety of welcoming home a new baby, and such the like. Right? Mood swings. So of course with the hormones, you're gonna have mood swings. You don't want anybody around you. You love your husband, you love your baby father, you love your boyfriend, you love your friends, your auntie, everybody, and all of a sudden you just want to be in a room by yourself with your baby. You know? Persons are unable to help you how they want to. Persons are unable to relate to you how they want to. You know, crying spells, often without a clear reason. So you're crying, the baby is crying, and when they ask you what is wrong, you don't know. You know? So those are some of the things. Anxiety, as we said, irritability, you get so angry because if you're lacking in sleep, you're going to become irritable. Your feeling of sadness or feeling overwhelmed. This is too much for me. It is, if you notice that any of these symptoms of postpartum blues are affecting you, and it is you in your mind, you know that something is not right. Do not stay and suffer in silence. Put on your clothes. Come up to the clinic. I won't turn your back. I will sit and listen to you for as long as you want. Right? Call our breastfeeding supporters. Call our breastfeeding facilitators. Reach out for help. Say something to your mother. Mommy, I don't like how I'm feeling. Something is not right. Say to your husband, listen, honey, something I don't know, but this is not me. I am sure they will understand. And for those, I will plea and beseech to the home help that these ladies are having, and the husbands too, because they do go through their fair share of depression and blues, right? If they complain to you that something is not right, I am gonna beseech you to listen. At least listen to them, because sometimes we tell them, oh, go and get some sleep. You know, you're not the first person to have a baby. You're not this, you're not that. And then when they crash and end up in the hospital, that is when you're willing to listen. Oh, I didn't know it was so serious, but they complain to you. So I'm asking everybody to listen out, look out, give a keen eye out on these mothers and their families, baby and spouse, when a baby comes into the home. All right? This is a term that all of us know so well. We hear it in the media, we see it in the papers, we hear it everywhere. Postpartum depression is a serious and a long-lasting mental health condition that can affect women after childbirth. Unlike the milder and temporary postpartum blues that we spoke about earlier, postpartum depression can persist for weeks or months and interfere with a mother's ability to care for herself and her baby. And might I add that it can go up to, the months can go up to a year. All right? And I still believe that postpartum depression can go beyond the year, to be honest with you. Causes of postpartum depression is pretty much similar to the postpartum blues, but in a case it is more extended, it's more severe. All right? So hormonal changes after birth. We know that going from pregnant to non-pregnant. Sleep deprivation. 3-4 days no sleep, this baby not sleeping at night, baby crying, groaning, you change the baby, you feed the baby, you do everything, and the baby still hollering, no sleep for you. Emotional stress or anxiety. History, for these mothers who have a history of depression or mental illness, we have to look out for these ladies because they can be easily triggered, especially if they have been off medication or if they are not taking their medication for some time. Or even if they're on medication, they can easily be triggered. Lack of support from the partner, family, or friends. So no home help, you know. And there I add that this can also put a lot of mothers into depression. Families will have their own ideology. Give the baby bush tea, give the baby glucose, give the baby formula. You're going to make the baby dead for hungry when the mother really wants to exclusively breastfeed. So because the mother is not listening to them, they withhold their help. And this can put the mother into depression. So I'm going to ask the families to desist from doing that. Support the mother. Some of the things that let you realize that, listen, is it possible that I'm going into postpartum depression? Persistent sadness or emptiness. So even though you have a baby in your hand, the baby at home, the husband is happy, this is our first child together, we got married, we're Christians, we're doing our thing, and we're living the life that we're supposed, we're living the ideal life. But you're still sad, you're feeling empty. That is when you realize that no, something is not right here. Loss of interest in things you once enjoyed. You know, some ladies who don't leave from in front of the glass, they have on the little eyeshadow, they take the little selfie, they put on the nicest of clothes, always going shopping, they do the pedicure, manicure, you know, the facial, always have the little hairstyles, always looking up, and then all of a sudden, you have no interest in any of that, right? Your hobbies that you used to love to do, you don't want to do it anymore. You find yourself crying very often for no reason. As I said, baby's crying, you're crying, you have no idea. When they ask you why you're crying, you don't know. Extreme fatigue, so you're always tired, or lack of sleep when night comes. So if baby happens to start sleeping at night, you now have a problem to fall asleep. You're constantly being irritable, angry, and anxious. As I said, even if you're getting the help, you know, nobody's there angering you, nobody's there irritating you, but you are just angry and irritable. You know, you're finding a difficulty to love your baby. So yes, you wanted this baby, you know, it was a planned birth, and then you're just looking at it like this is a baby, but you're not able to love the baby or connect with the baby. That is when you know that something is not right. Right? Feelings of guilt, worthlessness, or hopelessness. You have a baby at home, you shouldn't be having these feelings. You know? Thoughts of harming yourself or a baby in severe cases. You know, some persons jerk the baby. Just thoughts of hurting yourself or the baby, or even who around you, your baby father, your husband. You know, you just feel like just ending everything and you just cannot be bothered. What are some of the treatments that you can get when you have seen those symptoms and you say, today I'm getting help? You can go and seek counseling or therapy, right? And some of the things that the techniques that the counselors will use is a cognitive behavioral therapy, right? Medication, you can get antidepressants. If you're assessed and they note that you need antidepressants, you can get antidepressants that will help you. You can join support groups like this one. So you are fortunate enough to be in the support group. So you have ladies who will be able to share their experiences, like some of you will share experiences of you, right? Share their experiences so other mothers can say, oh, but wait, Nurse Bernard went through that too, you know? So that means say I am normal, you know? I'm not abnormal. I'm not the only one going through this. So you can share life experiences with persons. So you can get support. You can get ideas. All right, Miss, I am going through this now. How did you manage with that? You know? And so you're better able to cope. Lifestyle changes. For example, get some rest. Start eating your balanced diet, your nutrition, and asking for help. Don't try to say, oh, I'm superwoman. No, superwoman no longer exists. Ask for help at home, so that will limit the time that you have to be up and about doing things when you could, even if you're not sleeping, sitting down and getting some rest. We get into the seriousness of the matter, and this is end stage. When you would have gone through your postpartum blues, you would have gone, nobody would have picked it up, you would have now ended up in postpartum depression, and still no help was rendered. As I said, I normally tell them to go and lie down and sleep and judge them to say, give me the baby and go and walk and come back. Or say, you know, you're not the first one to have a baby. I have 5 and I didn't go through. Everybody is different. So now with all of that being said, and you would have not gotten any help, it now progresses possibly to postpartum psychosis. I know that this is pretty much new to some of you. You really never know that this thing was so serious. This is a whole topic over here, right? So also known as puerperal psychosis, and it is a term that covers a group of mental illnesses with the sudden onset of psychotic symptoms following childbirth. All right, so it can actually start during pregnancy. You can imagine if you're already in depression from pregnancy. When that baby comes, you're not eating, you're not sleeping, the postpartum changes, your hair shedding, all these things. You're just gonna lose it. Right? And so this is where we now have a serious issue on our hand. What is the cause of postpartum psychosis? Postpartum psychosis, it actually, as I said, is coming from postpartum blues untreated into postpartum depression untreated. Right? However, it is important to note that it generally happens when postpartum depression goes undiagnosed and help is not sought or given in time. You notice I keep repeating this. It is a time frame. Help must be sought. Help must be rendered to the mother and the family. All right? Now, what are the symptoms of postpartum psychosis? Hearing or seeing things that aren't there. So we say you're hallucinating, you're hearing voices. Some persons will tell us as midwives that somebody told her to throw the baby outside. Yes, these are serious things I'm telling you about. You know, she will say, she heard a voice that says, kill the man. and stuff like that. It's a lot of things I heard on the internet just this week, where a social media influencer, CPFSA, went to her house. I don't remember what her name is. She came online and she was venting that she feel like killing the man and hurting her children. And little did she know that it would have made its way to CPFSA. And CPFSA, what did they do? What? Oh yes, Rosalia thing, yes. And what did you think CPFSA did? They came in and they removed the children from the home. So now the baby father is blaming her. And she's now crying to say that she was not going to do her children anything. But you have to know that this is serious. When you see those ladies leaving their babies on the roadside. Yes, leaving their babies on the roadside. It is postpartum psychosis. Having the baby and throwing the baby in the pit latrine. And the people say, she wicked, eh? No, she not wicked. She have lost her mind. She's no longer thinking straight. You know, she's no longer here with us in the natural. She no longer thinking like you and I at this point. She has lost her mind. And that would have probably been helped if she had gotten help, as I said, from the blues stage or the depression stage. Right? So she's hearing all kind of voices. Believing things that aren't even true. So she's having delusions. It is a serious issue, ladies. Rapid mood swings, confusion, talking or behaving strangely. You hear the mother start talk some things. You know, she has the baby already and she's talking to herself like, I wonder if I'm still pregnant. Or some things that are just not of her. You know your sister. You know who you are, and you find, well, you're going to know when you're in the postpartum psychosis, but your relatives hear you talking some strange things, and they know right off the bat that is not Sheila. Sheila would never say that. Sheila's never, alright, Sheila is a Christian. Sheila is an evangelist. And all of a sudden, 8 weeks after Sheila have baby, they hear Sheila cussing bad word. You know definitely that is not Sheila, and straight up to the hospital. Alright? Thoughts, as we said, I'm going to remove the thoughts actually harming the baby. So when you reach the postpartum psychosis, the actual harm is happening. The thoughts, and then they act out on the thoughts because it would be tied to the hallucination where they're hearing the voices telling them to hurt the baby, you know, or hurt herself. Alright? So she attempts suicide, or she throw the baby in the river, throw the baby outside, throw the baby in the pit latrine, leave the baby in the ladder bag. Remember a few years ago a gentleman was passing on the road and he heard a baby crying in a ladder bag, and when he opened the ladder bag it was a baby. You remember that one about 2 years now or something like that? Yes, that mother would have been in postpartum psychosis. Alright? So ladies, it is a serious case. What is the treatment? When a woman gets to that stage, how do we treat these ladies? Hospitalization for safety and close monitoring, because as we said, she's a threat. If she has not already hurt herself or the baby or somebody in the house, she's now a threat to herself and all who are around her. So she is hospitalized. She's admitted on the mental ward for safety and close monitoring. She's given medication, antipsychotics, mood stabilizers. So how can the family help a mother postpartum? So after the woman has her baby, how can the family really help the mother? These are ways that you can help the mother, and I would want you to take a screenshot of this so you can share it on your statuses. How can families help mothers when after they have their baby, and the family, the husband and the baby? Help with cooking, cleaning, laundry, and running errands. So if our light bill to pay, you know, a water bill or insurance, don't allow her at 3 days, 4 days after her have her baby to be going downtown to Bill Express. You know, not everybody has online access. Go and offer to pay the bills for her. Bring back her receipt so she knows that she can trust you. Stuff like that. Take care of the older children. So if you're a big sister, while the mother has the young baby at home and you know that she might not be able to deal with the older child, you take the child for 2 weeks or a week and you bring over the child to see their younger sibling until mommy is able to cope with that other child at that point. Right? Encourage the mother to rest and recover. Take the baby from her. Use up your express breast milk. and give her some time to take a walk down the road. Give her some time to go and take a proper shower. You know, allow her to get her 3-4 hours sleep, so that when she gets up, she'll be less irritable and more accommodative to take care of the baby. Offer her listening ear. Let her express her feelings without judgment. And as I said, that is where we have a problem. If she's telling you how she feels, don't laugh at her. If she tells you that she wants to exclusively breastfeed, don't tell her that she's going to starve the baby. Support her as best as you can, because we have found that a lot of mothers go into depression when they are not being able to breastfeed how they want to breastfeed, especially those that really want to breastfeed their babies. Another thing, we ask the spouses to attend the doctor visits or the postpartum checks. So gentlemen, we want to see you at the 6-day visits. As a matter of fact, we want to see you from pregnancy. Come with her to a few antenatal clinics if you are not able to come for the long haul. We want to see you at 6-day visit. We want to see you at 6 weeks visit. We want to see you at the 3 months, 6 months, right up until the baby is 4 and 6 years old. Yes, we want to see you. It's one big happily family, right? Offer encouraging words and daily check-ins. So when you're at work, sir, call mommy and say, how you doing, honey, how you doing, you're coping, you need anything, you're good, you eat, you sleep, you bathe. Yes, that makes her feel, encouraged and checked on. Understand that mood swings and tears are common. So when she starts getting a little bit angry and moody with you, don't back off. Don't use it as a tool to go away and sit with your brethren for hours and you come home only when in the nights and stay away in the next room and avoiding her. Sometimes just hold her and hug her up. You know, we might not fight you. We might seem like we're cats. You know, cats are very protective of their kittens. But sometimes it's just a little hug we need. A little reassurance. My wife, you still look beautiful. Thank you for bringing my little one into this world. I appreciate you so much. This is a gift from you to me. And I love you for that. I promise to stay with you and support you. You know, these are the reassurances that we want to hear. Offer gentle reassurance and affection. Yes, kiss her every chance you get. Hug her up every chance you get. Give her a little back rub, a little shoulder rub, a little foot rub. Something, you know. Avoid putting pressure on her to bounce back. So some ladies, they wanted to be back in the gym at 4 weeks, 6 weeks. They're bringing you back into the gym to get you back to where you were before. Call her mother, sir, and say, listen, Sheila is not behaving like herself, you know. This is not my wife. Watch for warning signs of depression or anxiety and report it. Now, how can the community on a whole help a mother postnatally? Midwives, nurses, and doctors can offer professional guidance, as I am here with you offering professional guidance, right? So when you come to the clinics and all of that, and that's why we have our 6 days, 6 weeks, and so on, so we can chime in with you. We have our community health aides who go out and do their home visits, and if they notice anything abnormal, they come and say, nurse, something not right with Miss Sheila down the road, you know. I think you need to do a home visit, and so on. Community clinics can provide counseling or breastfeeding support. Hence why we are here in this mother-to-mother support group tonight. Join new mother groups in person or online. Hence why we are here tonight. Group therapy for postpartum challenges. Hence why we are here tonight. Alright? Peer support. Help mothers feel less alone. So tonight when I talk and I was here talking and you were like, you know, I went through that, but I didn't know there was a terminology for it, you know. But hold on, Nurse Bernard know about that, man. So I'm going to go up a clinic tomorrow and talk to Nurse about it, you know. And each one reach one. When a friend call you tomorrow and say, listen, I feel like I'm hearing voices, you can say, but Jesus, it sounds like she are going to postpartum psychosis. So, no sir, come, hospital, you know. And we have our churches who are also offering counseling to the mothers. So we have a big community out there. And it is for us to realize that this monster in front of us is real. No longer should we sweep it under the rug. You know, to say, boy, everybody go through it and them all right. Everybody goes through it, but not everybody is able to cope with it when it comes. All right? Postpartum depression is not a sign of weakness or failure as a mother. It can happen to anyone. Once you have a uterus, you are a woman. Regardless of your age, your background, or the number of children that you have had. Early treatment helps improve outcomes for both mother, baby, and the spouse, and of course, by extension, the family. While we talk about these this evening, lady, we're talking about the ladies, but we have to remember that the men do go through their fair share. So when your husband looks and see that you're going through so many things, don't you think it has an impact on him? The first thing he starts to feel guilty. Boy, if I didn't get her pregnant, she wouldn't have had that emergency C-section, and she was okay where she was, and just to give me a baby, look at what she's going through, near-death experience, and all of that. And then they would have been the one while you're in the hospital, running up and down, getting the things that you need and all of that. So they're tired. They're up with you at nights. For those who are able to be up, they're the ones while you're home with the baby, they're going out to work. So they're going through their fair share. So I encourage families, love on each other, reassure each other. And this is how we're going to get rid of or defeat this monster that begins with postpartum depression. Because as we said, postpartum depression is very normal. Your body's going to go through changes. But it is the time frame that makes it bad. So when it goes off into depression and then psychosis, that is when we have a challenge. All right?